Hello everyone, welcome to ITLS Academy. This is your mentor Dr. Shamaita Basu, and in this session we will be moving on with moving on to the next module of the course of medical coding. That is, as you can see over here, so the codes are running. Very sorry, I've just got a very bad cough and cold. Pardon me. So as we can see over here, the codes are running from P00 to P96. And they're corresponding to the conditions that originate in the in the perinatal period. Okay, now what do you mean by the perinatal period? So perinatal period is basically the period which includes the entire pregnancy period, the childbirth period, as well as the postpartum period. Okay, so it's counted over a week of 20 to 28 weeks of gestation to 1 to 4 weeks postpartum, post delivery. Okay, so that is what is the perinatal period. Now during this perinatal period means when the woman is actually pregnant, then she is going for childbirth, going for delivery, and then the postpartum period of 1 to 4 weeks. So during this period there can be a wide range of conditions, wide range of situations, wide range of pathological conditions that can occur. Okay, so basically in this topic or in this module we will be talking about each of those important conditions. Okay, so again I would just like to mention, as you can see over here, since the codes are running from P00 to P96, so we can imagine almost like 100 of codes and subcodes are there. So it's a huge topic, it's a large topic, so we will need at least 2 sessions or 2 lectures to complete this topic. So in this session we will be focusing on the first topic. Okay, so let's first see what are the different sets of codes and subcodes that we will be talking about in both the sessions of this topic. So first code is running from P00 to P04, which is corresponding to newborn affected by maternal factors and by complications of pregnancy, labor and delivery. So here we will be talking about only the disorders or the problems of the newborn, not the mother. Okay. Then we have P05 to P08, which are corresponding to disorders of newborn related to length of gestation and fetal growth. Again, we are concerned about the newborns only over here. Next is P09, which corresponds to abnormal findings on neonatal screening. Next is P10 to P15, corresponding to birth trauma. Next we have P19 to P29, which corresponds to respiratory and cardiovascular diseases specific to the perinatal period. Next we have P35 to P39, which corresponds to infections specific to the perinatal period. Then we have P50 to P61, which are corresponding to hemorrhagic and hematological disorders of the newborn. Next we have P70 to P74, which corresponds to transitory endocrine and metabolic disorders specific to newborn. Next we have P76 to P78, which corresponds to digestive system disorders of newborn. Next we have P80 to P83, which corresponds to conditions involving the integument and temperature regulation of the newborn. Next we have P84, which corresponds to other problems with newborn. And then we have P90 to P96, which corresponds to other disorders originating in the perinatal period. Okay, so over here there are some important crucial points or stages where they have not followed the chronological order, so I'd just like to highlight them. So right after P15 we are directly having P19, so 16, 17, 18 nahi hai. Okay, this is something we need to remember. Then again right after P29 we are having P35, so 30, 31, 32, 33, 34 nahi hai. Okay, next again P39 के बाद directly P50 आ रहा है, तो इसमें भी around 10 या 11 are missing chronologically. Next again P61 के बाद directly P70 आ रहा है, 62, 63, 64 till 69 not there. Okay, then again P74 के बाद आ रहा है P76, so 75 is not there. Then again 78 के बाद directly आ रहा है 80, so again 79 is not there. And then again last but not the least P84 के बाद directly आ रहा है P90, so again 85, 86, 87, 88, 89 नहीं है. Okay, so these are the places where we need to remember them specially with extra importance because they are not following the chronological manner. Okay, now talking or starting with the first important set of subcodes, that is, as we can see over here, running from P00 to P04. So they are corresponding to newborn affected by maternal factors and by complications of pregnancy, labor and delivery. Okay, so the first condition or the first what to say subcode that we will be going to talk about is newborn affected by maternal complications of pregnancy. So when a newborn is affected by maternal complications of pregnancy, it means the baby experiences health issues due to conditions the mother had faced during pregnancy. Because obviously, see, the baby is not yet born, isn't it? The baby is just developing, he or she, whatever it is, just developing. So all the organs or the all the body tissues, the bones, the muscles, everything is still in the developmental stage. So obviously it's not possible, it's theoretically, it's logically, scientifically, it's not possible that the unborn fetus will start suffering some from some of the fatal systemic disorders like hypertension, या फिर hyperglycemia, blood sugar. So that is something not possible. But still, in many cases, we see that the fetus, they are getting affected or they are suffering from many critical situations. So basically, those conditions or those situations that the fetus are suffering from, they are mainly due to the condition of the mother. ओके, सो मेन जो बीमारी है वो मदर का है, उससे अफेक्ट हो रहा है द फिटस. ओके, so these complications will include gestational diabetes. Gestational diabetes means diabetes which has occurred during the gestation, during the period of gestation, during the period of pregnancy. Before that, before getting pregnant, the mother did not have any history of diabetes. So that is gestational diabetes. Okay. Then we have preeclampsia, something I've already talked about in the previous session. Then we have various bacterial infections, placental abnormalities. Okay, one of the most important placental abnormalities, placenta previa. Okay, placenta previa is not actually a placental abnormality, it's a abnormality in the implantation of the placenta. Okay, so all of this can impact the fetal growth, development or delivery. Babies affected by maternal complications may be born prematurely, have low birth weight or face respiratory or metabolic challenges. Careful monitoring and specified neonatal care are often required to ensure the newborn's health and recovery. Okay, next important condition that we will talk about is newborn affected by complications of placenta, cord and membranes. Cord means the umbilical cord, obviously. So when a newborn is affected by complications of the placenta, umbilical cord or membranes, it can result in various health challenges. Conditions such as placental insufficiency, umbilical cord prolapse or infection of the membranes, which is also known as chorioamnionitis, can disrupt the flow of oxygen and nutrients to the baby. These complications may lead to preterm birth, low birth weight, or fetal distress during labor. Immediate medical care and close monitoring are essential to minimize the risks and ensure that the baby is well-being. Okay, so basically most of these conditions, the most common or the most fatal complications will be that the baby will be underweight or the baby will be suffering from fetal distress. Okay. Next important condition will be newborn affected by noxious substances transmitted via placenta or breast milk. So noxious means basically toxic substances, toxic to the baby. Okay, so obviously it's not toxic to the mother. That's why the mother has had it. But obviously it's toxic for the baby. Okay, because whatever the mother is consuming. Okay, now see, the mother can consume poison also. So that's a different scenario. But normally in many cases via some food or via some alcoholic substances or drugs like cigarette, ganja. So these things can also cause distress or cause toxicity to the fetus, which will not cause that much toxicity to the mother in the first place, isn't it? So when a newborn is affected by noxious substances transmitted via the placenta or breast milk, it means harmful substances like drugs, alcohol or certain medications have passed from the mother to the baby during pregnancy or breastfeeding. Because this part is very important, that you need to understand that whatever the mother is consuming, whether it's food, the mother can suffer from food poisoning also, isn't it? बाहर जाके कुछ बाहर का खा लिया, कुछ स्ट्रीट फूड खा लिया, गोलगप्पे खा लिया, तो वहां से भी इन्फेक्शन हो सकता है. So that is normal food poisoning. Besides that, alcohol is there, different drugs are there, smoking is there. So these are the things that the mother is consuming, and these will directly be going to the fetus. If the fetus is inside the body, then through the placenta, and if the baby is already delivered and the mother is breastfeeding the baby, then through the breast milk. So by whatever means, it will directly go into the body of the baby, unborn or born baby. Okay. So these substances can lead to health issues such as neonatal withdrawal syndrome, developmental delays, or growth restrictions. Depending on the substance and exposure level, the baby may require medical treatment and long-term monitoring to manage any resulting complications. Early intervention is crucial to support the newborn's health and development. Okay. Next important set of subcodes that we need to talk about over here, as you can see, they are running from P05 to P08. So they are corresponding to disorders of newborn related to length of gestation and fetal growth. Okay, so the first condition that we will talk about over here will be disorders of newborn related to slow fetal growth and fetal malnutrition. So they occur when a baby does not receive adequate nutrients or oxygen in the womb, often resulting in intrauterine growth retardation, which is also known as IUGR. Babies affected by this may be born smaller than expected for their gestational age and are at higher risks for complications such as low birth weight, difficulty regulating body temperature, and respiratory issues. These newborns may also face developmental delays or metabolic problems later in life. Early detection and specialized care during pregnancy and after birth are essential to improve outcomes. Okay, next condition, disorders of newborn related to long gestation and high birth weight. So they are often seen in postpartum babies, which can include complications such as birth trauma, respiratory distress, and metabolic issues like hypoglycemia. These infants, sometimes known as referred to as large cord gestational age or abbreviated as LGA, are at a higher risk for shoulder dystocia during delivery due to their size, which can lead to injury. Means there can be some kind of shoulder fracture or hairline fracture kind of thing. Prolonged pregnancies may also result in decreased placental function, affecting the baby's oxygen and nutrient supply. Careful monitoring and timely intervention are crucial to managing these risks for both the mother and the newborn. Okay, next important set of subcodes, as you can see, they are running from P09 to P09 only. So they will be referring to abnormal findings on neonatal screening. So they will indicate potential metabolic, genetic, or congenital disorders that require further evaluation and management. Conditions commonly screened for include phenylketonuria, that is PKU, which is a very common and very important metabolic disorder, or rather inborn errors of metabolism, hypothyroidism, cystic fibrosis, and sickle cell disease. Early detection through screening allows for timely intervention, which can prevent severe complications like developmental delays, growth problems, or life-threatening crisis. Follow-up testing is essential to confirm the diagnosis and initiate appropriate treatments. Okay, next important set of subcodes, as you can see over here. So they are running from P10 to P15 and they are corresponding to birth trauma. Okay, so let's see what are the different subcodes that are there. So they are following the chronological manner, so no problem. So first is P10, which refers to intracranial laceration and hemorrhage due to birth injury. Then we have P11, which corresponds to other birth injuries to central nervous system, that is CNS. Then we have P12, which corresponds to birth injury to scalp. Then we have P13, which corresponds to birth injury to skeleton. Then we have P14, which corresponds to birth injury to peripheral nervous system or PNS. And lastly, we have P15, which corresponds to other birth injuries. Okay. So first we will be talking about P10, that is intracranial laceration and hemorrhage due to birth injury. So it refers to damage to the brain tissue or blood vessels caused during the delivery process. This can result from complications like prolonged labor, forceps, or vacuum assisted deliveries, or excessive pressure on the baby's head. The bleeding within the brain can lead to serious neurological complications such as seizures, developmental delays, or cerebral palsy. Prompt diagnosis and intervention are critical to minimize long-term damage and improve outcomes for the affected newborn. Okay, next we have P12, which corresponds to birth injury to scalp. So it is a common occurrence during delivery, especially in prolonged or assisted births using tools like forceps or vacuum extractors. Common types of scalp injuries include caput succedaneum, which is a swelling of the scalp, and cephalohematoma, which is a collection of blood between the scalp and the skull. While these injuries often appear as bumps or bruises, they typically resolve on their own without long-term effects. In rare cases, more severe trauma can lead to complications requiring closer medical attention. Next, we will talk about P13, which corresponds to birth injury to skeleton. So it can occur during a difficult delivery, especially in cases of large babies, breech presentations, or assisted births using forceps or vacuum extractors. Common skeletal injuries include fractures, most frequently of the clavicle, that is the collarbone, which may cause pain, reduced movement, or swelling in the affected area. These injuries often heal quickly with minimal intervention, but more severe fractures, such as those to the skull or long bones, may require specialized treatment. Early diagnosis and proper management are important to ensure optimal healing and prevent long-term complications. Next, we will talk about P12, which corresponds to birth injury to PNS or the peripheral nervous system. So it typically involves damages to the nerves outside the brain and the spinal cord, often occurring during difficult or assisted deliveries. One common example will be brachial plexus injury, which can result in weakness or paralysis of the arm if the baby's shoulder is stretched during birth. Facial nerve injury may also occur due to pressure from forceps or prolonged labor, leading to temporary or permanent facial muscle weakness. Early diagnosis and rehabilitation therapies such as physical therapy can help improve outcomes and promote nerve recovery. Okay, next important set of subcodes that we need to talk about. So they are running from P19 to P29 and they are corresponding to respiratory and cardiovascular disorders specific to the perinatal period. So let's see what are the different subcodes. So first we have P19, which corresponds to metabolic acidemia in newborn. Then we have P22, which corresponds to respiratory distress of newborn. Then we have P23, which corresponds to congenital pneumonia. Then we have P24, which corresponds to neonatal aspiration. Then we have P25, which corresponds to interstitial emphysema and related conditions originating in the perinatal period. Next, we have P26, which corresponds to pulmonary hemorrhage originating in the perinatal period. Next, we have P27, which corresponds to chronic respiratory disease originating in the perinatal period. Next, we have P28, which corresponds to other respiratory conditions originating in the perinatal period. And last but not the least, we have P29, which corresponds to cardiovascular disorders originating in the perinatal period. Okay. So over here, I think there is some discrepancy in the chronological manner. That is, after P19, we are directly having P22, and the remaining are maintaining the chronological manner. Okay, so let's move on. So the first condition that we will talk about is metabolic acidemia in newborn, which corresponds to the subcode P19. So it occurs when there is an excess of acid in the blood, typically due to insufficient oxygen supply during labor and delivery. This condition can result from factors like prolonged labor, placental insufficiency, or umbilical cord complications, leading to the accumulation of lactic acid. Metabolic acidemia can cause complications such as respiratory distress, organ dysfunction, and in severe cases, long-term neurological damage. Prompt recognition and treatment, including oxygen support and correcting the acid-base imbalance, are crucial to improving outcomes for the affected infant. Next condition that we will talk about is respiratory distress of newborn, which corresponds to the subcode P22. So this condition is marked by dyspnea with cyanosis, heralded by such prodromal signs as dilatation of the alanasi, expiratory grunt, and retraction of the suprasternal notch or costal margins, most frequently occurring in premature infants, children of diabetic mothers, and infants delivered by cesarean section, and sometimes with no apparent predisposing cause. Okay. Next important subcode that we will talk about is P23, which corresponds to congenital pneumonia. So it is a lung infection that occurs in newborns, typically within the first 24 to 72 hours of life. It can result from infections acquired in utero, means while the baby was inside the uterus, during delivery, or shortly after birth, often caused by bacteria, viruses, or fungi. Symptoms will include respiratory distress, rapid breathing, and cyanosis, that means turning blue. Early diagnosis and treatment are critical, usually involving antibiotics and supportive care to improve outcomes. Next, we will talk about neonatal aspiration, which corresponds to the subcode P24. So it occurs when a newborn inhales substances like amniotic fluid, meconium. Meconium is basically the fecal discharge or the feces which often the baby passes during delivery or right before delivery. or milk into the lungs. This can lead to respiratory problems including difficulty breathing, coughing, and cyanosis. Aspiration may occur before, during, or after birth and can result in conditions like pneumonia or respiratory distress syndrome. Prompt medical intervention such as clearing the airways and providing respiratory support is crucial to prevent complications. Okay. Next important subcode that we need to talk about is P26 that runs, which corresponds to pulmonary hemorrhage originating in the perinatal period. So it refers to bleeding into the lungs of a newborn, typically occurring within the first few days of life. It can result from factors like prematurity, birth asphyxia, or underlying heart and lung conditions, leading to respiratory distress, blood in the airways, and decreased oxygen levels. This condition requires immediate medical attention, often involving respiratory support and treatment of the underlying cause. Early detection and management are key to improving outcomes in affected infants. Okay, next important subcode that we need to talk about is P27, which corresponds to chronic respiratory disease originating in the perinatal period. So it's often seen in preterm infants, which refers to long-term lung conditions like bronchopulmonary dysplasia, which is abbreviated as BPD. So these conditions typically arise from lung immaturity and prolonged mechanical ventilation or oxygen therapy. Affected infants may experience ongoing breathing difficulties, reduced lung function, and increased susceptibility to respiratory infections. Management focuses on providing respiratory support, optimizing nutrition, and monitoring for long-term respiratory complications. Okay, next important subcode that we need to talk about is P29, which corresponds to cardiovascular disorders originating in the perinatal period. So it involves structural or functional heart abnormalities present at or shortly after birth, such as congenital heart defects or persistent pulmonary hypertension of the newborn, which is also abbreviated as PPHN. These conditions can lead to poor circulation, difficulty in breathing, and inadequate oxygen delivery to the body. Early diagnosis through echocardiography and prompt treatment, which may include medication, surgery, or specialized care, are crucial to managing these disorders. Timely intervention helps improve the infant's chances of long-term health and development. Okay, next important set of subcodes that we can see over here are running from P35 to P39, and they are corresponding to infections specific to the perinatal period. So let's see what are the subcodes. So first we have P35, which corresponds to congenital viral diseases. Then we have P36, which corresponds to bacterial sepsis of newborn. Then we have P37, which corresponds to other congenital infectious and parasitic diseases. Then we have P38, which corresponds to omphalitis of newborn. Then we have P39, which corresponds to other infections specific to the perinatal period. So again over here they're following the chronological manner, so there is no problem. Okay. So the first condition that we will talk about is bacterial sepsis of newborn, which corresponds to the subcode P36. So it is a life-threatening infection that occurs when bacteria enter the bloodstream, leading to widespread inflammation. It typically manifests within the first month of life and can be classified as early onset, which is within 72 hours, or late onset, which is after 72 hours. Symptoms will include fever, difficulty feeding, lethargy, and respiratory distress. Prompt diagnosis and treatment with antibiotics are essential to prevent serious complications, including multi-organ failure. Next important condition that we will talk about is congenital viral diseases, which is corresponding to the subcode P35. So it is a condition when a fetus is infected with a virus during pregnancy, often through maternal transmission. Common viruses will include cytomegalovirus, that is CMV, rubella, and Zika, which can lead to birth effects such as hearing loss, developmental delays, or brain abnormalities. These infections may not always present with symptoms at birth but can cause long-term health issues. Early detection and appropriate medical interventions can help manage complications and improve outcomes for affected infants. Next important condition that we will talk about is omphalitis of newborn, which is corresponding to the subcode P38. Now this is an interesting scenario. So it is an infection of the umbilical stump, usually occurring within the first few days after birth. It is characterized by redness, swelling, warmth, and discharge around the umbilical area and can sometimes spread to surrounding tissues. This condition is often caused by bacteria such as Staphylococcus or Streptococcus, and if left untreated, it can lead to serious complications like sepsis. Prompt treatment with antibiotics and proper umbilical cord care are essential to prevent complications. Okay. Next important subcode that we need to talk about is P37, which corresponds to other congenital infectious and parasitic diseases. So over here we have different, subcode ka bhi subcode. Okay. So I will just mention the names one by one. So point 0, point 1, point 2, point 3, point 4, point 5, then point 8 and point 9. So just one place is there where they're skipping the chronological manner, so I've just highlighted it. So first we have congenital tuberculosis, then we have congenital toxoplasmosis, then we have neonatal or disseminated listeriosis, then we have congenital falciparum malaria, then we have other congenital malaria, then we have neonatal candidiasis, then we have other specified congenital infections and parasitic diseases, and lastly we have congenital infectious or parasitic disease unspecified. So first we will talk about congenital tuberculosis. So it is a rare but serious infection transmitted from the mother to the fetus during pregnancy, often through the placenta. Newborns with congenital tuberculosis may present symptoms like fever, difficulty in breathing, poor feeding, and an enlarged liver or spleen. Early diagnosis can be challenging because the symptoms often resemble other neonatal infections, but prompt treatment with anti-tuberculosis medications is crucial. Without timely intervention, the infection can lead to severe complications or even be fatal for the infant. Next, we will talk about congenital toxoplasmosis. So it's a parasitic disease which is caused by the parasite Toxoplasma gondii, and it is transmitted from the mother to the fetus during pregnancy. This infection can cause a wide range of severe symptoms including hydrocephalus, chorioretinitis, and neurological impairments. Symptoms may not always be present at birth, and some infants may develop issues later in life. Early diagnosis through prenatal screening and timely treatment with antiparasitic medications are crucial. Okay, next we will talk about congenital falciparum malaria. So we all know what is the causative agent for malaria. It is again a parasitic disease, and over here the name is already given, that is Plasmodium falciparum. So it is transmitted again during pregnancy from the mother to the fetus, often through the placenta. It can lead to severe symptoms including anemia, low birth weight, and jaundice. It can cause complications such as neonatal sepsis or organ dysfunction if not treated properly. And then we will talk about neonatal listeriosis. So it is again a bacterial infection which is caused by the bacteria Listeria monocytogenes, and it is again transferred from the mother to the infant either during pregnancy or during delivery. And the symptoms will include fever, difficulty in feeding, lethargy, and signs of sepsis or meningitis. Again, early treatment and diagnosis will be very much crucial. Next, we will talk about neonatal candidiasis. So again, it's a fungal infection, candidiasis, caused by the fungus Candida albicans, which primarily affects the newborns. It can be manifested in various forms, including oral thrush, cutaneous lesions, or invasive disease affecting the internal organs. Premature infants and those with weakened immune systems are at higher risks. Early diagnosis and appropriate antifungal treatment are crucial for managing the condition and preventing complications. And last but not the least, we will be talking about congenital viral diseases, which corresponds to the subcode P35. I think I've already talked about this before also. So it's transmitted from the mother to the baby during pregnancy, often through the placenta. And some of the common viruses will be CMV, rubella, and Zika. And it can lead to severe complications like neurological impairment, hearing loss, and developmental delay. So again, early diagnosis and treatment is very much crucial. Okay, so I think that's it about the first part of this important module. We will be soon moving on to the second part of this module. Till then, thank you and goodbye. Please like, share, and subscribe ITLS Academy.